everybody. My name is John Blanchard from Salta Direct Primary Care, and today is April 9th, and it's day number 17 in the COVID camper. I hope everybody's doing well out there. Today I'd like to cover, the questions I'd like to cover is some of the terminology that we're hearing in the news. I know a lot of people are watching the news, probably not a good idea to watch that all day, but it's important that you understand some of the terminology that they're using in the news to describe what's going on. I have a lot of questions about what these things mean. So one of the things they're talking a lot about is called a antibody test. And what that means is we're trying to come out with a test where we can check for antibodies in a person's blood to detect whether they've been exposed to COVID or have had COVID and are now immune to COVID. It's important to know this because those people then could be released to go outside, go back to work, and that sort of thing. And so it's a very helpful thing to know. It also helps us, you're going to start hearing a lot about something called source tracing, and doing antibody testing and testing for COVID is going to be really important to do trace testing once we lift this quarantine so that we can identify quickly if we have a case of COVID, trace who that person's been exposed to, and then try to quarantine those people so that we can stop that chain of contamination from spreading wider. So that's called trace testing. You're going to be hearing a lot about that, and source tracing. Another concept that you might hear about is called herd immunity. So one of the big concerns that we have right now is if there isn't a large number of people in the community who have antibodies to this or who are resistant to it, who've had it and recovered, or maybe didn't even have symptoms but have antibodies to it, which can happen. If we don't have a large number of people in the community who have immunity, then when we release the quarantine, there could be a second wave that happens. And you may hear people talking about second wave, which means that the virus starts transmitting widely in the community again, leading to another large number of people needing hospitalization and hospital services. So source tracing, antibody testing, widespread testing for COVID is all really needed in order to control the spread of the virus when we release the quarantine. Another thing that you're going to hear about is point of care testing, which is a test that Abbott came out with that allows us right in my office or our doctor's offices to test directly for COVID. So it's a swab in the nose and you put it into a test kit and it detects evidence of the virus there so that you can make a diagnosis within 10 or 15 minutes. So you're going to hear more about those, and we should have those point of care testing available in doctor's offices hopefully soon. Another thing you might hear about is a clinical trial. What is a clinical trial? Well, it's very important that we do trials on treatments to make sure that they're safe and effective. We don't want to rush because of fear to use widespread treatments for people that may have side effects. We've talked about that in previous videos. Some of these treatments can have serious side effects like hydroxychloroquine and others that we need to do trials to know that one group got a medication, another group didn't, and the group that got it got better, and it wasn't just due to chance, that it was actually because of the medication and showing that it's safe. So those are some of the terminology that you're going to hear in the news over the next few weeks, and hopefully that'll help you to understand what they're talking about. One of the things that I hope that comes out of this, we've talked about this before, is this concept of mindfulness. And it's really important because all of us want what you might call a good life. So what is a good life? Well, we all have a different definition of that, but from my perspective, a good life is feeling a sense of peace, joy, happiness, healthy relationships. And if we want a good life, a good life is driven by actions. So actions drive a good life. And our actions are largely driven by our emotions, our feelings. So if we feel a certain way, it drives us to act a certain way. And our feelings are driven by our thoughts. So thoughts cause feelings, feelings cause actions, and actions determines your life. So if you want a good life, you start with the right thoughts. It all starts up here with your thoughts. I'm covering different thought distortions that can occur, which can interfere with healthy relationships. It can interfere with your goal of having a good life. And one of those that I've covered today, we've covered black and white thinking. We've covered personalization. Today we're going to cover should statements. So oftentimes, almost always, if you catch yourself saying should or ought to or must, then that's a thought distortion. So you can use should statements as it pertains to yourself, or you can use should statements as it pertains to somebody else, but they're almost always a thought distortion. So someone might say that I should have done better on that test, or I should lose weight in order to look as good as I can be. Should statements or ought statements or must statements, or I must lose weight in order to look good. Those, when they're applied to yourself, drives feelings of guilt and shame, which is not good, healthy feeling when they're not accurately reflected. Clearly, sometimes we do or say something that we should be guilty or feel shame for. That's our conscience, but should statements often are not because of that. They often drive guilt and shame. When you apply it to someone else, he should have done this, or she should thank me for doing these things for her. When we apply it to someone else, it drives frustration and anger oftentimes in a relationship. So those are should statements is something that we should really try to avoid. One of the things that I like about being a direct primary care doctor is that we can provide care according to a person's needs. So a lot of people now today are going to urgent cares, they're getting care online, and they're doing that because it's convenient. What we try to do in direct primary care is make our delivery system meet the needs of our patients. So sometimes people want to get in and get right out, so we make that appointment, very quickly. They don't have to wait a week to get an appointment. They don't wait in the waiting room. They get in, get out. Other times people want to spend more time with us, and so we can have a visit that goes for 30 to 60 minutes in addressing all of their needs, and not saying like we can only do one thing and then you come back in a couple weeks for another thing. We can address all of your needs in one visit. Or sometimes people, they just want a phone conversation or a video visit, or we give access to our panels of patients 24 hours a day, so they can reach us 24 hours a day for urgent care needs that happen after hours or weekends. So this is something that I really like about being a direct primary care physician. And if you are interested in learning about direct primary care, or to see how direct primary care can work for you, you can visit us at facebook.com/saltoftroy, facebook.com/saltofclarkston, or you can call Kyle at 248-922-3076. I look forward to talking to you again. We're going to start doing 2 videos a week with these updates, and if you have any questions you want me to answer, just put those in our Facebook page, and I'll be happy to answer those. And again, stay safe out there, love each other, and we'll see you again soon.